Hello and welcome to the second cattle health testing webinar. After our introduction a few weeks ago, we're now going to be talking about Neospora in cattle. I bet you didn't think we'd be talking about Neospora so early in the programme, but it's actually one we get quite a few questions about, and so we thought we'd deal with them today. As a brief reintroduction, my name's Dan Humphries. I'm a dairy vet, but aside from clinical work, some of my time I spend providing veterinary advice to CIS, and some of that veterinary advice comes in the format of these webinars. So without further ado, we'll crack into the world of Neospora. So Neospora in cattle, what is it? So it's a protozoan parasite that affects cattle, and you can find it's not just cattle that it affects. You see them in a lot of other species as well, predominantly or particularly dogs, for example, but it affects cattle worldwide. It is actually the most commonly diagnosed cause of abortions in the UK in cattle, just above Salmonella Dublin in the recent tables in dairy cattle. And what's interesting is it looks like disease incidence, particularly in the UK, looks to be on the rise whenever we do any kind of prevalence testing. And a little bit of background on Neospora just to get us started. There's loads of good resources on Neospora that will go into the kind of the disease processes in much more detail than I will. Such things like if you look at the NADIS website, that's quite a good baseline for lots and lots of different conditions, but also Neospora predominantly. Basically typing it into Google, you'll see lots of different articles from the farming press. You'll see lots of things from checks. You'll see things from the milk recording companies like CIS. So there is a wealth of information out there, but for the sake of this this presentation, this little webinar, just to run through a couple of little background bits. How does it work? So Neospora is that protozoan parasite, and there are two main mechanisms of kind of transmission of that, and you'll hear them referred to as either horizontal transmission or vertical transmission. So horizontal transmission is basically where a cow consumes the parasite that's usually from dog feces and contaminated pasture or feed. And so that is often the introduction of a new infection into an animal. And the second kind of transmission is called vertical transmission. And so once an animal's infected, once a female's infected, there are a few things that can happen when she gets pregnant. So what we can see is we can either see that animal abort the pregnancy, and like I said, Neospora is the most commonly diagnosed cause of abortion in cattle. Or we can cause that calf to be infected but not aborted, and we end up with a persistently infected calf. And then finally, another option is that we can sometimes see calves born with neurological signs. There's little signs of or weakness. We don't see that very commonly, actually, but it is something that's certainly possible. The points to remember, or the key points with Neospora, are that infected animals will be infected for life. Once Neospora gets in, there's no cure or treatment, and it hides away in little cysts in the brain and in some of the muscles. And then these animals, actually, when they're infected, are unlikely to look ill at all. You can't spot them as being infected with the parasites, other than perhaps the rare occasions where you do get the calves with neurological signs. The animals are unlikely to look ill, even when they've just been infected. There's no sudden illness at the first time they encounter the parasite. But these animals, they're about depending on the study you look at, they're between 3 and 7 times more likely to abort than an animal without Neospora. And that risk is even higher in their first pregnancy or their first pregnancy after infection, and drops a little bit after that. But the route of vertical transmission from dam to calf is really very efficient. And so they're extremely highly likely to transmit the disease in utero to the calf. And so if you've got heifer calves coming off that animal is likely to be infected and then abort or transmit it further on throughout its life. So we're on to testing for Neospora, which is the meat and bones of this webinar. And we can sort of split the testing up into 2 main types of testing. The first of which would be diagnostic testing. And in this instance, it would be in the cases of abortions that we start doing diagnostic testing to see if Neospora is around. And Of course, in cases of abortion, we're not just looking for Neospora, we're looking for quite a few other things that could potentially cause abortion. So the samples we're submitting in discussion with your vet, of course, should usually be the fetus itself, some placenta, and a blood sample from the dam. And this wide array of samples gives us the best chance of actually finding out what caused the problem. Sadly, about over half of the abortion investigations that we carry out, we don't actually find the cause of abortion. We don't find anything specific. But by providing these samples, it does give us the best chance of finding what's caused it. In the cases of Neospora, there aren't any actual visual signs that you can see that you could see the calf out of the cow and go, oh, that was Neospora. So when they're submitted to the laboratory, they'll actually be looking for Neospora itself with the PCR reaction, looking for the DNA signature of Neospora in some of the tissues, or we can actually look for microscopic changes in particular organs in the brain and in the heart to see the damage that Neospora will cause. But in the cases of like abortion or where we're actually looking for a diagnosis, then submitting those samples is key. And that's not something that we do through CIS. That's often something that's done in conjunction with your vet and often the Veterinary Laboratories Agency. The second type of testing then is surveillance, and that's kind of like actually monitoring for the disease, monitoring for the prevalence of the disease so we can actually manage it. And that's much more what we do with CIS is actually look for these animals that are infected, not when they've aborted, but hopefully before then, and then we can actively manage these cows. So Neospora surveillance is all predominantly based on ELISA testing. So if you remember from the first webinar, and I'm sure you all took notes, ELISA testing is we're looking for proteins, and there are different types of ELISA tests, but these ELISA tests are antibody tests. And an antibody is a sign of an immune response to a pathogen or to something that we want to get rid of. And so when we're looking for it, we're looking specifically in this case for the immune response to Neospora. We're not looking for Neospora directly, we're looking for immune responses to it. And we can look for that in either blood samples or milk samples. And with milk, you've got the option of doing individual cow samples or pooling them in bulk tank samples. To deal with the bulk tank samples first, if you were to look into this a bit further, you will see that there are quite a few different opinions on whether bulk tank testing for Neospora is worth it or not, if it's a sensible idea or not. And the reason for that is because of the dilution effect, really. Like, the test actually has quite a low sensitivity when we're looking in the bulk tank. And that low sensitivity means that we might miss positive cases. You might have one cow that's contributing a lot of antibody into the bulk tank, but she could easily be diluted by 199 other cows, which are negative. So a bulk tank negative result doesn't actually tell you a lot. You couldn't rely on it to say, my herd is completely Neospora negative. I've got bulk tank results to show it. However, the flip side of that is a bulk tank positive is significant. Because the tests are highly specific, it is going to be Neospora antibody that they're finding. If we're finding quite a level of Neospora antibody in your bulk tank milk, then there is a certain amount in the herd. So it is actually quite useful. You can't really rely on the negative result, but a positive result you can rely on. And as such, bulk tank monitoring is not really used for individual herd management, so managing your own cows. But they're used quite commonly for kind of national prevalence studies. And when we actually look into the national prevalence, the most recent one of 500 dairy herds in Great Britain came with about 51% of herds came back positive. So in reality, it's probably more than that, but 51% of herds came back positive, which is quite a shocking number. It's quite high. So individual cow surveillance. The things to note about Neospora is antibody levels change over time quite a lot. And understanding how the antibodies work means we can actually decide when to test to get the best test results, the most reliable tests. And so the antibody levels are actually highest near the end of pregnancy. They climb during pregnancy. And the reason for that is, for the majority of the time, the Neospora are sort of controlled within the cow, and she generally keeps a lid on infection. But during pregnancy, the immune status of the female changes, of the dam changes, so that it doesn't reject the calf. So it sort of down-regulates quite a few processes in its immune system. During this time, the Neospora thinks, right, the immune system's down-regulated, I'm getting out of here. Gets out of its little cysts we talked about earlier and starts being more active. And as it's more active, it does stimulate an immune response. So what we see is the antibody levels start to climb and climb and climb and climb. So we know the antibody levels are highest near the end of pregnancy. So the best time to test for antibodies to see if they are there is around then. And people talk about between 10 and 4 weeks before calving. So milk samples, if we're testing for milk samples, we're looking for the last recording pre-dry off. But we could also test just after calving, because although the antibody levels will be falling, they should still be fairly high at that point if they are there. However, there is a bit of variation. So we talked a few minutes ago about what the results mean for different cows in different situations in bulk tanks. What does it mean on an individual level? So an antibody positive animal shows that that animal has been exposed to Neospora and should be considered infected. And it's worth discussing with your vet how best to manage these animals, because your management strategy from that point will depend on quite a few factors. Firstly, what are you actually wanting to achieve? Are you wanting to achieve a completely Neospora negative herd accredited by checks or something? Or are you hoping to just manage the disease? There's a few different options. If you've got low prevalence in the herd, you might decide I'm going to cull those 3 cows that come back positive and be done with this for now. Or if you come back with 50 cows with it, okay, now I'm going to have to manage it. So there's obviously quite a few factors which are well worth discussing with your vet. So the second individual cow result we can get is that the cow is antibody negative. And so that shows that animal currently does not have circulating antibodies to Neospora. Sadly, that doesn't mean definitively that that animal does not have Neospora. So most of the schemes require 2 negative tests at high-risk periods, so late pregnancy, to confirm actual negative status. And of course, even if a cow has negative status now, there is the potential that it could be introduced into the herd in terms of horizontal transmission, as discussed earlier. So an antibody negative result is a good thing, but we can't depend on it completely. We're looking for multiple tests to really make sure that that's the case. One thing about the antibody negative results, though, is if we get an antibody negative result in association with an abortion, it really does mean that Neospora was unlikely to be the cause of that abortion, even though that animal could still actually have Neospora. So one question we often get asked is, okay, so these calves are infected in utero, so surely I can test the calves for Neospora to see if they've got it, and then we can manage them from there on in. So that vertical transmission is extremely efficient. So well over 90% of the calves from Neospora positive dams will have Neospora. And so the testing of calves for Neospora itself is not very reliable. And there's a few reasons for that. So there's the maternal antibodies in the colostrum. So we might be just measuring the cow's immune response rather than the calf's particular. The calf itself has a naive immune system, so it won't really have got round to upregulating its own immune processes to be able to identify and actually fight Neospora off or keep it under control. So it is much, much more reliable to test the dam. And the rule is that if the dam is antibody positive, then your calf is extremely highly likely to be infected and should be managed as such as well. So what's next for Neospora? There's a bit of talk about vaccination, and there's lots of work that's done into vaccination because Neospora is a significant problem throughout the world, really, and all these abortions and pregnancy losses and loss of family lines, they do carry a cost. There are actually Neospora vaccines in some countries in the world, but when actually tested, they don't seem to actually work, which is a bit of a problem. So therefore, they're obviously not licensed in the UK. However, there's projects at places like Morden in Scotland where they're really trying to get a successful vaccine to use, but these processes take quite a bit of time. There are some other little tricks that come out in terms of the management strategies. So there's a nice piece of research that was done a little while ago that shows that if you were to cross your dairy cow server with a Limmy sire, then you actually half the risk of abortion, which is interesting. So there's some little tips and tricks that you can find out in discussion with your vet. And there's also other little bits of technology like embryo transfer that offers potential opportunities to minimize the damage caused by Neospora in a dairy herd. But if you want to find out some more information about Neospora, then by all means talk to your vet. By all means get in touch with us here at CIS. Or there's lots of information on websites like I've referenced earlier, like NADIS, the National Disease Information Service. So there's lots to have a little look at. But if you have any particular questions about the testing or how this health testing might work for you, then feel free to call your CIS area manager. Online, there is a nice interactive map, and you can actually click on your location and you'll find out who to get in contact with. There's the head office number on screen there, and there's a lovely email address, and of course CIS are active on social media as well, so you can get in touch there.